Hi, everyone. Sorry for the delay. We are live now. We'll give it just a few seconds for everyone to join, but thank you guys for joining us today. My name is Amanda, and I'm joined by Dr. Juli. We are here at the end of Arthritis Awareness Week, a wonderful week dedicated to raising awareness about arthritis. So I'll give it just a few seconds for some viewers to join, and then we'll kind of get it kicked off. Happy Friday, everyone.
Yay for Friday.
Cool. All right. Well, let's kick it off. So thank you again for joining us today. My name is Amanda. I am the campaign and veterinary manager here at Barker Beds. For those who might not be familiar, Barker Beds is proud to be the only dog bed clinically proven to improve joint comfort, mobility, and overall quality of life. So our mission has always been to help dogs live more comfortably by addressing one of the most common health challenges dogs, especially big dogs, face, which is joint pain and arthritis. So joint issues can affect dogs of any size, any breed, but our beds are specially designed to support every dog, no matter what their size or breed is, through every stage of their life, helping them live a pain-free, active life. So this week was our 5th annual Arthritis Awareness Week, which is so amazing that we've been able to do this for 5 years now. And this week is dedicating to educating owners about canine arthritis. So our goal for this week is to raise awareness of the signs, early stages of arthritis, prevention strategies, and management techniques that you guys as pet owners can make a real difference in your day-to-day dog's comfort and long-term health. So whether that's spotting early signs or just knowing all the pain management options that you have available for you, this week is truly about empowering you guys as pet owners to feel like you have the knowledge and tools that you need to help your dog live a pain-free, active life. So today, I am super thrilled to be joined by Dr. Juli Goldstein. She is a technical services veterinarian with PetVivo Animal Health. She brings a wealth of knowledge in small animal care, clinical research, and palliative care. And a fun fact about her is she's actually known for her work with the dolphins in the movie Dolphin Tale, Winter and Hope. So she currently consults for NOAA Fisheries and serves on the Auburn University College of Medicine Alumni Advisory Council. That is a long name. So Dr. Juli, thank you so much for being here today. I know our viewers will be excited to learn more and hear about your expertise. So would you mind just introducing yourself, sharing a little bit about your background, and then really I'd love to dive into why arthritis awareness is so important.
Yeah, well, thanks so much, Amanda. War Eagle for any Auburn fans out there or not. Yeah, I've had an interesting career. I currently serve as a small animal technical services veterinarian for PetVivo Animal Health, as you mentioned, and my job is to help pet owners and clients learn about regenerative medicine ways that they can help their pets, specifically with arthritis, which, you know, is everything that we're talking about today. I've worked on a lot of different species, and I'll say that this disease does not discriminate on species. So it's great that we're really focusing on this because people, we get it. My knees crack. All our pets, our animal species, exotic species get it. So it's something that universally affects the animals that we love so much. So it's really important that we're talking about it because it's not something that we just have to accept that, oh, we're aging or maybe even not aging and we're having extremely painful things happening to our joints that that's not something that we need to accept for people or for our animals. So I'm really excited to be here and talk about this with you today because it's such an important topic.
Awesome. Yeah. And we are grateful to have you here too and share your knowledge. So to all those who have just tuned in, so the past week, we've actually been collecting your questions. So each day we send out a little Q&A. So at the end of the week, you had opportunity to get your questions answered by Dr. Juli. And we got some really great questions sent in throughout the week. So I'm going to kind of turn it back over to Dr. Juli, and we're going to kind of go through those customer questions that you guys have been asking throughout the week. But if you guys do have any questions As we're going through this, feel free to put them in the chat and we'll try to address them. If not during this live, after the live is over. So to kick it off today, we're going to start with our very first question, which comes from Robin M. So her question is, she has 2 Barker beds for Cooper. Awesome, Robin, great to hear that. One in the living room and one in the bedroom. And recently he was diagnosed with slight arthritis in his left shoulder. And she says it shows in the AM. So can you suggest the best ramp or steps that can kind of help him get in and out of the car?
Yeah. So first of all, hi, Cooper. Pet your dog for us. Yeah, ramps or steps are essential, especially when you have a dog that has already been diagnosed with arthritis. So things, I generally tend to recommend a ramp over steps. It's just a little bit easier, less impact, especially on those front limbs, because that's where they're putting those that weight to climb. So you want to make sure that it's wide enough for Cooper's body size, that there's good traction and support, so that when he's climbing and using these ramps, that he's not slipping, and potentially causing more injury. So I definitely am more of a ramp fan than I am a stairs fan, but I will talk a little bit about stairs. And I think brand doesn't really matter. You just want to find the best fit for your particular dog.
Absolutely.
Every dog is different. So again, same thing with stairs. You want to make sure that they're wide enough, that they're deep enough, but not steep enough, if that makes sense. And that, again, good traction. And I would make sure that you're putting the ramps and the stairs in all the areas that you may not even think about. Like if your pets like to cuddle with you on the couch, you should have nearby, or in the bed, not just in the car. And even if they don't seem sore in the morning, I would still make sure that those resources are available for your pets, because they may not always show those signs of pain, but we already have a diagnosis. It's lingering. This is a very painful disease. So
absolutely. And I'll just speak to the car from our end too. So we do make an SUV bed and we make a travel bed too. And of course, some people will ask, well, how do I actually get my dog into the car? So this is a great, to Dr. Julie's point, just having something to be able to easily get your dog in and out of the car, such as having a ramp for them to get in and out. So then you don't have to worry about, if they're huge Mastiff, for example, you don't have to worry about trying to lift them. And they need something that's supporting them and stable for them to get in and out. So great question, Robin. Thank you so much. Let's dive into the next question. And this comes from Sarah B. She says, my senior dog sometimes hesitates before jumping up on the couch or, again, into the car. But he doesn't seem to limp or seem like he's in pain. Could that be an early sign of arthritis?
Yeah, really great question. I mean, these climbing movements and ascending and descending movements are really difficult for our senior pets, but absolutely that could be an early sign. And depending on your dog, like dogs, any animal, they're very good at masking signs of pain.
Yes.
So if you've got a very stoic animal, like some of us have, some of them, my animals were kind of babies, so they may cry if you look at them funny, but a lot of animals are not like that. That's instinctually how they're built, is not to show that. So having that kind of hesitation is definitely a warning sign that it's time for a vet visit, because something is definitely wrong. Other things you may want to think about too that could be warning signs are things like behavior changes.
Yes.
So maybe they loved going for car rides, and that was just the thing that you did with your pet, and now all of a sudden they're maybe not as enthusiastic as doing those things, or playing games of fetch, or doing all those normal activities that you normally enjoyed with your pet. That also can be a very big warning sign that arthritis may be looming. And it may not be early arthritis.
Right.
Either. Again, if you've got a stoic pet, this could have been going on for a long time, and it's just now gotten to the point where they can't not show signs. So absolutely. Definitely talk to your vet. Even the subtlest, it may seem like a silly thing to you, is really important to discuss with your veterinarian to get a proper diagnosis.
Yeah, and that's part of this week is really for us to just have pet owners feel empowered to make those calls. because it would be easier if dogs could talk, right? If they could just tell us how they felt.
Got up, you know.
Right, but often, like, what happens is people will wait until they're visibly limping or in pain. So as pet owners, like, it's up to us to make those decisions on behalf of our pets. So we want everyone to feel like their best pet's advocate. So looking for those signs, looking for even just the smallest changes, like, your dog better than anyone else. So advocate on their behalf for them.
Yeah, Amanda, I mean, that's so true. And that's one thing I've said to all my clients when I'm in clinical practices. I've just met your pet for the first time today. You know them way better than I do. I've known them for 5 minutes, and things that may feel silly that you may not want to bring up to a doctor, those are probably the very things that you should be bringing up. So look for those subtle changes, because this is a disease that affects almost 1 in 5 dogs of all ages. And so there's a good chance that your dog is going to be on that list. And this will probably be a theme throughout today, but prevention, anything that we can do to prevent or slow the progression of this disease is a good thing. So the sooner you can get a diagnosis, the sooner you can initiate treatments, and then, get that quality of life back up for your pets, get them out of pain, which is, what's the most important thing here.
Awesome. And with that, we'll jump into the next question. So this one comes from Tom C. So he says, can weather changes really make arthritis worse, or is that just a myth? My dog always seems a little bit slower on cold or rainy days.
Absolutely. Thanks, Tom, for that question. And no, it's actually not a myth. This can happen with pets. It can also happen with people too. So you may notice, and you may notice this in your pet too, when the weather is cold or damp or there's extreme changes, they may be a little bit stiffer, a little more uncomfortable. We don't, there's been a lot of studies on this, and we don't really understand the full mechanism about it, but it's changes in that barometric pressure can certainly affect our joints and our whole body comfort. So things you want to do are, avoid extreme changes in temperature in your pet. So if you know that, it's time to go out for a walk and it's really cold that day, doing things like putting on a coat, a properly fitted jacket, booties, things to protect those extremities can be very helpful. Avoiding going out during extreme temperature times of the day. So early in the morning when it's super cold, probably, if you can avoid it, not the greatest time to take them out. But again, making sure that you take those precautions if you have to do that. When you got to go, you got to go. So you just want to be prepared for that, and know that it's not just in your imagination. It certainly can affect your pet's comfort. So these are also things to talk to your veterinarian about if you're noticing that. There are multimodal things, which we're talking about a lot today, that you can do to help ease their comfort and pain.
Yeah. And I guess even not so much on the arthritis front, but like even in summertime, right? Like we try to emphasize shorter walks, probably early mornings, like know what you would want to do as a human and relay that to your dog too, because again, they can't speak. So advocating on their behalf and knowing what is best for them is what this week is all about.
Absolutely.
We do have some audience questions, so I'm going to actually take a step away from our questions that were submitted throughout the week, and I'm going to jump into one here. So a question we had from the audience is, my senior dog loves to run but has some arthritis. His leg with arthritis will shake when he stops. Is there a good alternative for runs? His doctor has not yet suggested to take medication.
Yeah, so running is a pretty high impact exercise. I used to run with my dog all the time. I'm a runner myself. So that can be really hard for both of you when doing those normal activities is, not as feasible. So think about doing lower impact activities. So, it's hard to tell a dog, no, you can't run, but you can go to softer surfaces, maybe do shorter amounts of activity more frequently. If you are noticing that shaking and the discomfort, I would certainly be proactive and ask your veterinarian. We have to be our own pet's advocate, and your veterinarians appreciate that too, because of course, your dog better than we do. So, animals, I personally also have white coat syndrome, and a lot of animals kind of, oh, I'm fine. I'm not shaking, I'm not limping. So, what's happening at home is important for you to relay to your veterinarian, especially with what you're observing with the running activity. So I'd probably hold off, on doing that high impact exercise and focus on maybe more short, frequent walks, sniff walks, adventures around the park. So they're still getting that stimulation of being outside, and then talk to your vet about what, options are for comfort.
I love that. Yeah. And again, it's tailored to your dog too, right? Like there's not one single answer that can work for every single dog. So really spending that time like with your vet and creating a plan tailored to your dog, I think would probably be the best course of action here. So I'm going to jump back to our submitted questions, and we are getting some more audience questions. So thank you guys so much. Keep them coming. So the next question comes from Michelle B. She says, are there any red flags that I should watch for that might mean my dog's arthritis pain is getting worse or not being managed well enough?
Yeah, Michelle. So this is a great question. And, I don't know what your dog's baseline is, but these things can apply to all pets in general that may be suffering from arthritis, or, that it's looming and they're about to, they're getting to that age where this could be a problem. So if you notice limping or increased limping, a lot of times people will come to me and say, he was sleeping, and just when he gets up in the morning, he's a little stiff, and then he kind of works his way out of it. So if that's happening every day or even once, that's certainly a red flag that we're not managing it. We need to maybe add some more things, get a Barker bed,
Yes.
So when they are resting, that they have, that support, that orthopedic support that they need. Increased stiffness, during normal activities, that could be a sign. Any kind of reluctance to do activities that we normally once enjoyed. So maybe your dog's eating fine and walking fine and acting normal, but all of a sudden now it's that time to go to the park and play fetch, which we do every day, and they're like not into it. That's, I mean, that could be a whole slew of other things, but that certainly, could be a sign that maybe it's getting worse. They're avoiding things that they normally like to do. Other things to look for are muscle loss. A lot of times we'll see, you could have a really heavy dog, a lot of, unfortunately, 50% of US dogs and cats are considered overweight or obese.
Wow.
We have an obesity epidemic in this country with our pets too. And that extra weight on the joints is really harmful. It's difficult for them. But I bring that up because a lot of times you can have a pretty hefty dog and still have muscle loss. So they might have they might look really big with really skinny legs, still around that area, where it looks unusual to you. That could be a sign, because they're not able to use those joints and that leg to the full capability that they were before. Using muscle, and you may not even notice it in a dog that has a little extra fluff. So so any of these things are warning signs and things you need to talk to your veterinarian about too.
Yeah, and I think that's such a great point too, because there's so much that we can learn from our vet, but also there's so much that we spend the most amount of time with our pets. So if we see something that's out of the ordinary, that's the perfect time to go to your vet and advocate on behalf of your dog. Like Dr. Juli emphasized, like even if the smallest thing to you seems off and you feel their ribs or something and something doesn't feel right, like you are the one that is in charge of them. So I love that. And I think that actually ties perfectly into the next customer question that we received this week. This comes from Ethan G. He said, how do I balance keeping my dog active, but protecting their joints for the future?
Yeah, Ethan, that's a great question. I mean, all these questions are so good. I love how involved, our pet parents are, but it's tough because it is a very fine balance. So movement is important, lubricating those joints, getting that range of motion. So one of the keys is consistency. So you want consistent movement, but you want to also not push your pet or overdo it. And that can be a very fine balance. You know, my late dog did not have an off button with the tennis ball. Like, he was obsessed, and
Yeah.
he would probably literally run himself to death. I know that's morbid, but that's how much he loved that activity. So
Yeah.
we need to sometimes think for our pets too. So, you know, instead of being like a weekend warrior, you know, we all work, it's difficult to get out with your pets, and a lot of people, and for themselves and with their pets, will go out on the weekends and do like a 4-hour hike.
Right.
But during the week, they're just sitting under your desk while you're sitting at your desk. So avoid things like that. So think, you know, even 10-minute bursts of activity. So multiple 10-minute walks throughout the day, mild to moderate activity, and low impact as much as you can keep it, will keep those joints lubricated and moving, which is important, but also prevent, you know, that harsh kind of one-time overdoing it.
Yeah.
So, and then being proactive with care too. So doing things like joint support supplements can help. Thinking about, and we'll talk about this a little bit later, but regenerative medicine, doing things where you know you have a joint that's starting to have some problems, and being proactive about slowing that progression is really important. And then again, having your orthopedic bed.
And the bed, of course. And yeah. And that kind of goes into what we were talking about, you know, with what you had kind of said during day 3, which is that multimodal approach, right? Like, there's not one thing that's the end all be all. This is how your dog's life is going to be changed. It's all these different things: supplements, bedding, rehab, veterinary care, making adjustments, like taking those 3 walks a day and shortening them so your dog is still getting activity, but it's not like over strenuous on their joints. So I think all of these tie into just making sure your dog is comfortable, but also, you know, you're still getting them the activity that they need for throughout the day.
Yeah, and that's important for their mental health too. So for all species, you know, as you age, you have to make adjustments in your lifestyle and things that you're doing, and not having the mental aspects of that as a part of it can affect the physical. So, you know, if your dog is not able to be as active, maybe they can't run at the park, maybe they can't go on long hikes or long runs with you, take them to a different part of the neighborhood and do sniff walks.
Right.
Because that's going to stimulate their brain, keep their mind active, which in turn keeps their body healthier.
Yeah, enrichment is so important for your dogs too. And to the point of beds, right? Like, once your dog is enriched and active, they need something to come home and let their bodies rejuvenate and rest on. And this kind of ties into actually one of the next customer questions that or live questions we receive, which is, how can I tell stiffness is normal aging versus early arthritis? Which I'll let you answer in just a second. But to the point of beds, like, what do dogs do almost all day? They sleep, right? So after a full day of activity, they need something that their bodies can relax on, that they're waking up and they're probably going to be less stiff because their joints aren't on the ground. So Julia, I'll let you take that one. But the question that we receive from the audience is, how can I tell if stiffness is normal aging versus early arthritis?
Right. So that's a really interesting take on it. So I'll say first that this is one of the first things that they taught us in vet school too, which was longer ago than I like to admit. But aging is not a disease. However, your body ages, your cells age, things change. So, you know, having normal aging doesn't necessarily mean that you should accept it as part of your dog's daily. This is just how they're going to be. And I think that's one of the biggest mistakes as pet owners, and I put myself in that category too, that we make. Well, they're old, so this is going to happen. And and yes, that is true, but that does not mean that we shouldn't be doing something about it. So if your dog is stiff, does that mean they have full blown arthritic changes in their joint? No way to know without actually going in and having it's possible, but there could be other things. Stiffness could be, you know, muscle stiffness. It could be they're sore from an activity. It could be a muscle strain as well, or it could be degenerative changes that happen. So if you're noticing that, it's time. I know I sound like a broken record. It's time for a vet visit, because we shouldn't have to, and your pets shouldn't have to accept that as normal, so to
Right.
speak, that there are things we can do to make them more comfortable and slow whatever that degenerative process is happening, try to slow it down and keep them as comfortable as possible.
Yeah, I mean, you wouldn't want to be in pain yourself. So I know a lot of our very passionate pet parents would agree that seeing your dog visibly in pain is literally the worst feeling in the world. So
Yeah.
really emphasizing like early action, and don't wait until your dog is visibly limping in pain to think that that's time. Like as you said, we sound like a broken record, but
Yeah.
being that advocate, even from when they're young, like if you notice something when they're a puppy, especially for dogs that are like prone to joint issues later in life, like
Yep.
what Dr. Juli emphasized, like learn those signs, so you can be their best advocate like throughout their entire life.
Yeah. I mean, there's a lot of good tools and resources out there. I mean, I've also specialized in hospice and palliative care, which isn't necessarily just for old dogs that
Right.
have terminal diseases. It's for all pets that may need it. And there are a lot of resources your vet can help you with where you can go on and actually answer questions that you can do at home. PetVivo Animal Health has one. We have an arthritis checklist just to like questions maybe you wouldn't have thought about or things you wouldn't have thought about with your pet that, you know, how this disease can affect their daily life. So, you know, say for instance, oh, they're not grooming as much as they used to, or they can't, you know, and you see this maybe more in cats than dogs, but they can't lick, you know, towards their back where they used to be able to. You might not think about that day to day, but that could be a sign. And so having checklists at home, and maybe we can send it to your viewers too. It's just
absolutely.
a simple thing that you can do periodically as like a check-in with your pet to help you figure out where your dog is at in their journey with aging. So
yeah. And we did include that in yesterday's email or Wednesday's email. So we'll be sure to include that in the wrap up as well, just as a recap information. But it's a great resource. I know I was looking at it when your team sent it over to us. So yeah.
Yeah, it's really helpful. I mean, just to look at we do that a lot in the hospice space as well when we have to make those tough decisions, but understanding quality of life, because it's not always obvious, because our pets want to be with us and they want to be with us. And even if they're hurting, they, you know, that's part of the bond. Going for your daily walk or your daily run or hike with your dog, they love that just as much as you do.
Yeah.
And they don't want to disappoint you. So they may try to do that through the pain. And so we have to kind of think for them a lot of times and be, like you've said, be that advocate and make those decisions that, oh yeah, it's a bummer that we can't do that. But there are a lot of other things that you can do to keep that bond strong and still enjoy your time together.
Pull out the heartstrings a little bit.
Yeah.
Well, I know we've gone through a lot of questions already, and I know there's some other ones in the chat, but since we're kind of nearing the end, I'm actually just going to finish off with one of our last customer questions we got this week. But I would encourage people to still keep sending in their questions. We'll try to get those answered after this event is over, and we'll share out those resources. But Dr. Juli, the last question that I have for you for today is, are there any treatments besides traditional pain meds that can help rebuild or restore joint health over time?
Yeah. So, you know, arthritis, unfortunately, there's no magic treatment. You know, there's no one magic pill that we could take maybe one day. So as we've been kind of repeating this theme also throughout today, the multimodal approach is really important. And what that means is just, we have to kind of, you think of it like a pizza, we got to start layering on things. So maybe we support the joints with, you know, joint supplements, we get the dog bed, we try some rehabilitative things, and a lot of the treatments that we have they're masking the pain. So they aren't fixing the problem, and which is important. You know, they take non-steroidal anti-inflammatories, probably the number one thing all vets reach for when their dog has arthritis, appropriately so, because it's very effective at relieving. but that's not doing anything to the joint itself. And so regenerative medicine is something that's been around since the 90s, and it's kind of slowly evolving. It's been very well studied in animals and humans. So things like platelet-rich plasma. But what I love about these kinds of modalities is that you can actually put it right inside the joint. So you're going right to where the problem is. So one of
Wow.
our products is called Spring, appropriately so, and it helps kind of
Yeah.
stimulate the joint capsule to be healthier. So these types of modalities are going right to the source of the problem. They're not going to fix it. This is not, again, there's no magic bullet for treating arthritis,
Right.
but we can go right to the joint health, go right to the source of the problem. It's a great alternative or great addition to helping your pets feel better, as opposed to just, like we take a pain medication and our headache goes away. But
Yeah.
we give them a pain medication, it decreases the inflammation, but they're still active on those joints. So if they feel better, they could be causing more problems. So it's not
Yeah.
adding a solution, whereas doing some of these regenerative medicine modalities are an addition that can help maybe hopefully slow the progression and have the joint be a little bit healthier, which is ultimately what we want. So
Yeah. And I mean, how lucky are we as pet parents to have so many different options
yeah.
to care for our pets? And obviously, like, at Barker Beds, we trust the science, we trust the data, we trust our veterinary partners. So when you're looking for all these different multimodal approaches, like, do your research and know what works and what doesn't work. And again, advocate on behalf of your dog. What is going to work for your dog might not work for somebody else's dog, and vice versa. So throughout the week, I think that's just what we're trying to emphasize.
Yeah, and educate yourself and ask a lot of questions. So, our vet clinics are very busy. We know this. There's a lot of patients that need help. There's sometimes some places there's not enough vets to help the pets. So come in there armed with information. And, we use this term in hospice and palliative care. You're part of the caretaker team. You with your vet is part of that team
Yes.
to help your pet's overall health. So, it should be an open dialogue and conversation. And, your vet may not know, your vet may not know about certain products available. They might know that they can inject something into the joint that can really make a difference in your
Yeah.
dog. So, I'm as a veterinarian, I never stop learning. I never want to stop learning. And so I love it when I have clients come to me and ask those questions and teach me things too. So it really should be a nice
Yeah.
collaborative process when you're talking about your pet's health.
Awesome. Well, I know we're already extending time, so I think I'll probably cut off the questions there, but thank you so much for sharing those insights. I feel like we covered a lot in a short amount of time, and we could have a whole day worth of conversation.
We really
But
could.
thank you so much for your expertise there. So while we get ready to announce the giveaway winner, I just want to take a quick moment to thank all of our partner brands who helped make this giveaway possible. So our friends at Jolly Pets, Link, Spring, of course, Jope, Charlie Bear, and Barn Dog. So thank you guys for being part of our giveaway. So without further ado, drum roll, please. Our giveaway winner is Michelle Z. Congratulations. You are the winner of an amazing prize package, which includes a choice of Barker beds. You can pick whatever bed you want. Some toys from Jolly Pets, a Link device with a fall wrap bundle, a spring joint injection, which Dr. Juli has expertise on, Joe hip and joint supplements, a case of Charlie Bear nuggets, and a Barn Dog shampoo bundle. So you are set with all things arthritis. So we'll be reaching out directly after this to coordinate your delivery of your prizes. So before we wrap up today, for more information on canine arthritis, please visit the link below, which is Arthritis Week landing page. This has all the resources that we shared by veterinary professionals this week. Within that, we've also linked all of their social media accounts, so feel free to give them a follow on Instagram. And then you can also visit Spring Health, which we showed before, to learn more about how to help animals with debilitating lameness and joint issues return to that improved quality of life. So Dr. Juli, I'm going to turn it back over to you real quick. Is there anything else that you would like to add before we wrap up today?
Yeah, I just think that, arthritis, it affects, as I've said before, so many of our pets. And this pain and this discomfort is not something that you need to accept or that your pet needs to accept. We have a lot of options. We have regenerative medicine therapies. We've got supplements. We've got beds. So work with your veterinarian as your pet's advocate and pet parent to really come up with a good multimodal approach for your pet to make them more comfortable. And the more comfortable they are, the longer they'll be with us. And that's what we all want.
Absolutely. That's awesome. I appreciate all of your insights. So thank you to everyone who tuned in today. Thank you for those who submitted questions, to Dr. Juli, of course, for sharing her expertise and joining us today. And then quick shout out to all of our veterinary professionals who contributed this week: Dr. Thomas Jackson, Dr. Deb Taraka, of course, Dr. Juli, and then Doctors Jeremy Ajovi and Danielle Conaway. Thank you again to all of our incredible brands who helped make our giveaway possible. And then thank you for allowing us to be advocates on behalf of your dogs as well. We love that our beds are changing lives every day. Again, there's so many amazing resources out there. So continue to advocate on behalf of your dog and continue to be that resource and the voice that they don't have. So without any further ado, we'll end it there. But thank you guys again, and I hope you have a wonderful weekend ahead.
Happy Friday.
Bye.